Gas prices, inflation, rising crime, and the pandemic, they have many of us dealing with a higher level of anxiety.
And earlier this month, the U.S. Preventative Services Task Force, a government-assembled panel of medical experts, recommended that all adults under 65 get screened for anxiety. Joining us to talk about anxiety is Dr. Nicole Siegfried, Chief Clinical Officer for Los Angeles-based Lightfully Behavioral Health. And Doctor, it's great to talk to you. And this is, I know, such an important topic, but it's also such a mystery to so many people. So it's good to get some clarification on these issues. So why is anxiety so important to identify? And what does the screening entail?
Yes, I'm so glad to be here. Well, first of all, anxiety is a very common emotion and actually a very adaptive emotion. We need anxiety. We know that anxiety can increase performance, improve performance at times. And also there's times where we want to have a good dose of anxiety to help us study before a test or something like that, so we're prepared. But other times anxiety can lead to suffering. And that's what we're seeing a lot of. You mentioned some of the triggers related to the pandemic, and we're seeing an increase in those symptoms in terms of difficulty sleeping. We've seen individuals have muscle tension, they're worrying more often. We also see an increase in panic attacks where individuals in the moment may feel severe panic and fear as though they're going to die or that something terrible is going to happen. And so those are some examples of symptoms that would be associated with a disorder that would be outside of that typical level of anxiety that might be adaptive.
Also, you're talking about some of the things that we should be watching out, but is there certain signs? Are there some signs that you can see that are developing in, say, in a family member or even in yourself to see if you can pinpoint if you are dealing with anxiety?
Yes. So oftentimes it's hard to see anxiety. It's hard to know that someone else is struggling. People can put on a brave face. And so this is one of the reasons this screening is so important, because it asks the questions of what might be behind the brave face. And so the symptoms someone may be experiencing may be more internal, where their thoughts might be racing, they're worrying constantly, they may feel more irritable, they may have trouble breathing, they may feel on edge. And sometimes you can see that in your loved one, but sometimes that people can put on a front and sort of behind the scenes be struggling more than it seems.
Well, unfortunately, we are out of time because we had that press conference earlier, but there's so much more to talk about. But we would love to have you back on and understand more about this case. And I guess the good news is more and more people are taking it seriously. Dr. Siegfried, thank you so much for joining us today. She's with the LA-based Lightly Behavioral Health, so it's great to talk more about this.
I agree with you, and we have a lot of questions.